Can you see those slides okay, Laura?
Absolutely, yes. Coming through
Great.
fine.
I don't use Teams as often, so I want to make sure.
Yeah. It's not like Zoom. I don't have to make you the presenter. I think you just share the screen on this one, right?
Makes it easier.
It does, yeah. And I think the audio is better on Teams too. I have your slides from like last year. Have you changed them at all?
I have updated them some. I can
Okay.
also send you a PDF of the slides if you want to share them. Feel free.
Okay.
Hi, Connor.
Hi.
Do you know who I am?
Yes, I do, Dina.
Hello, everyone, and welcome. We'll be starting in about 4 minutes.
At the top. No. Go.
Okay. Okay. Good evening, everyone. My name is Laura Gaffney. I'm the Director of Family Support at Durand. So glad that you joined us tonight. Many of you expressed an interest in Durand's programs. I want to direct you to our website that I'll put in the chat tonight. I also want to pass on the fact that I will be muting everyone for the duration of the call of this presentation. And I will also will be making time for questions at the end. Many of your questions have been submitted to the presenter ahead of time, and Connor assures me that a lot of those will be answered during the course of the presentation. We hope that you enjoy the presentation and that it's relevant to you. I'm so glad that you joined us. And without further ado, I'd like to present our presenter, Connor Griffin, MPH, Director of Healthcare Advocacy at the ARC of New Jersey. Take it away, Connor.
Well, thank you, Laura, for that great introduction. Good evening, everyone. My name is Connor Griffin. I am the Director of Healthcare Advocacy with the ARC of New Jersey. And tonight I will be talking about how parents' Social Security benefits impact their adult child with IDD. We have someone that needs to be muted.
Yeah, okay. I'm going to ask you all to mute. I'll just mute everyone.
Sure. Thanks, Laura.
You are unmuted. No. Unmuted. You are unmuted.
Laura, when you muted everyone, you muted the speaker also.
Oh, sorry about that.
Yeah, he has to unmute himself. Please remain muted. Thank you.
Thank you, Laura. So the ARC of New Jersey, we are the state's largest organization advocating for children and adults with intellectual and developmental disabilities, IDD, and their families. We're an affiliated chapter of our national organization, the ARC of the United States. We offer community-based direct support services available statewide through our strong network of 20 local chapters across all 21 counties in New Jersey. We are primarily an advocacy organization that conducts public policy work, community outreach, and information and referral services. The ARC of New Jersey, we have many programs, and you can check those out on our website if you go over to arcnj.org. There's quite a few different acronyms I'm going to be using tonight over the course of this presentation, so I like to lay them out in front of you before I get too deep in the weeds. You can see here that DDD stands for the New Jersey Division of Developmental Disabilities. A DAC is a disabled adult child. A person with IDD is someone with intellectual and/or developmental disability. SSA is the Social Security Administration. SSDI is Social Security Disability Income that is based on work history. SSI is Supplemental Security Income, or SSI, that's not based on work history. And SGA is Substantial Gainful Activity. So the main topics I'm going to be discussing over the course of this presentation include New Jersey Family Care Medicaid, when a parent starts collecting Social Security or passes away, as well as SSI and SSDI, what Social Security's official definition of a DAC or a Section 1634 DAC, as well as how you go about renewing Medicaid, employment, workability, and that SGA I just mentioned, able accounts and special needs trusts, and lastly, Medicare and Medicaid or dual eligibility. So to start out with the New Jersey Family Care and Medicaid piece. For those who don't know, New Jersey Family Care is the state Medicaid program in New Jersey. Each state has a unique name for their Medicaid program. In New Jersey, it is New Jersey Family Care. And now there are two really main different types of Medicaid. That is New Jersey Family Care Medicaid that covers children under 19 through the Children's Health Insurance Program, lower income adults that meet the income guidelines, and pregnant women. This is sometimes also referred to as Affordable Care Act or ACA Expansion Medicaid, because New Jersey is one of the states that opted to expand its Medicaid program to cover more eligible populations, or MAGI, Modified Adjusted Gross Income Medicaid, since it is based on income. The other major main type of Medicaid is Aged Blind Disabled or ABD Medicaid. This covers people who are 65 and older, and people determined blind or disabled by Social Security or by the state of New Jersey. The majority of individuals with IDD, they usually have an ABD type of Medicaid. But to touch a little bit more on the ACA MAGI Medicaid, this eligibility is based on income and is not tied at all to an individual if they have a disability. That doesn't mean that someone with a disability can't qualify for that type of Medicaid, but you don't need medical documentation in order to qualify. There's also no resource or asset limit. Instead, this type of Medicaid is primarily looking at the monthly income, which for 2024 for a single adult was a little over $1,700 per month. That number will actually be a bit higher for 2025. New Jersey Family Care hasn't quite released the new 2025 figures yet, but it gets adjusted each year tied to the federal poverty level. So that number will actually be a bit higher for this year. Now, someone cannot have ACA or MAGI Medicaid as well as Medicare, or if the individual is claimed as a dependent on the parent's tax return. What happens then is Medicaid looks at the entire household's income, and this usually prevents someone from qualifying for Medicaid. Most of the time, ABD Medicaid is going to be a better option if the individual has a disability and they meet the financial criteria to qualify. So the ABD Medicaid is a bit different. It has several different sub-programs, unlike the other type of Medicaid. And this includes the Medicaid that someone gets when they qualify for SSI, the DAC Medicaid, which I'm going to cover plenty in this presentation, a type of non-DAC Medicaid, which someone can qualify for if their income is too high, actually through the DDD waiver unit. There's a New Jersey Care Special Medicaid that someone can get by applying through the county. New Jersey Workability for people who are employed. I'm going to cover that as well tonight. And Managed Long-Term Services and Supports, or MLTSS, for individuals that have a higher level of care, such as needing nursing level care. But for all these different programs, there's still only one ABD application, no matter what program someone's looking to qualify for. And you can see here, I included a link to the 2024 brochure that's put out by New Jersey Family Care that does explain each of these programs in some more depth. If you're really unsure about the type of Medicaid that your child has, ABD or the ACA MAGI Medicaid, you can always call New Jersey Family Care at the 1-800 number I listed here. Now I'm going to get into when a parent is actually looking at retirement and their Social Security benefits, or if the parent does happen to pass away, and what this looks like for SSI and SSDI for the adult child with IDD. So for Social Security retirement, when it comes to the parents, If someone is born between 1943 and 1954, the full or normal age for retirement is 66. If someone is born between 1955 and 1960, you see this age will gradually increase beyond 66. And if someone is born in 1960 or later, it's age 67 for that full retirement benefit. Now, a parent can collect as young as age 62, but they do face a penalty in the benefit. Or if they actually wait longer until age 70, they get an increased benefit. If you want to look at this and some other information, there's a link here to the retirement benefits planner on ssa.gov. That's very helpful to look at as you're approaching retirement. Now, to set the record straight between what is exactly SSI and what is SSDI and how you know to identify the differences between them, SSI is supplemental security income. The determination is based on having a severe disability and very limited income and resources. The SSDI is Social Security Disability Insurance. This is also based on Social Security's determination of a disability, but also on work credits. A Section 1634 DAC is someone that receives this SSDI via a parent's work record. Now, sometimes a person might actually have the SSDI, but they never had the SSI. A lot of the time, when someone reaches the age of 18, they're considered an adult and they apply for SSI and get the SSI and Medicaid. But sometimes, if a parent collects Social Security retirement before the individual turned 18, the parent becomes disabled. Or if the parent did pass away, then what happens is before the age of 18, that child might already be receiving SSDI. And that's either going to be calculated on the parent's work record if it was SSDI that's coming from the parent's retirement or disability, or when the parent does pass away, it's referred to as a survivor's benefit. And this is still calculated on the parent's work record. Now, as I just mentioned, when looking at SSI and Medicaid in New Jersey, many adults who are 18 and older that have IDD, they have SSI and Medicaid. We usually encourage someone to apply for SSI at age 18 because if someone is approved for SSI, they'll get Medicaid coverage automatically without having to do a separate Medicaid application. And Medicaid, beyond providing health coverage for a person, is also needed for an individual to qualify for DDD services, usually when they graduate from school and they reach the age of 21. Now, there are often changes to that adult child's SSI and Medicaid. When the parent starts collecting Social Security retirement, they become disabled or they pass away. So how it previously used to work was a little bit different. It was that when a person with IDD, they had the SSI and they had the Medicaid, and when a parent, say, started collecting Social Security retirement, that switch to SSDI and their disabled adult child status was automatic. Now, unfortunately, it's not quite automatic. Instead, what parents must do is a new application with Social Security before this DAC status can take place. And we've seen reports where the DAC status wasn't able to be verified because there was not sufficient information to prove that the person had Social Security, they have the disability status before age 22. This is why we really emphasize that it's important to save all medical and IEP documents from that initial SSI application that you're doing at age 18, or if later for the individual. You want to save that all. You want to have a physical file as well as an electronic file, ideally. And those can be very helpful to really expedite and make that reapplication process to get SSDI and DAC status go a bit more smoothly. Now, once SSDI begins, if the person needs DDD services, then once again, they must have Medicaid. Medicaid is required. It goes hand in hand with the DDD. So once the SSDI starts, their resources cannot exceed $2,000. And this is the same rule as it was with SSI. SSI has that $2,000 resource limit. And this persists with Medicaid when someone is granted that DAC status, they're getting SSDI, they still got to stay under this resource limit. And that is a Medicaid rule. It's not necessarily a Social Security rule. Now, families should be very aware as they're working with Social Security representatives. Oftentimes, they don't know that Medicaid is required for DDD services. And also, they might not know about the DAC Medicaid in New Jersey. So really disregard it if a Social Security representative says there's no resource maximum for people who receive SSDI. While that may be technically true, Medicaid does have the $2,000 resource limit. So even though it's not on the Social Security side, on the Medicaid side, you still have that resource limit. Or sometimes, more upsetting, I've even heard of Social Security representatives telling families, well, they're going to start getting this SSDI benefit. They're not going to be able to qualify for Medicaid any longer because they're making too much money now. That's not the case. They don't know about the DAC Medicaid and how the SSDI income that comes with that is actually disregarded by Medicaid. So even if they are making over the Medicaid income limit, they'd still be able to qualify for Medicaid. That's one of the advantages of this DAC status. So please, if you hear this from a Social Security representative, don't take it at face value. Make sure you're getting the correct information and reach out to me if needed. Now to actually get into Social Security's official definition of what constitutes that Section 1634 DAC or disabled adult child. And I'm also going to talk about what the process looks like for renewing Medicaid when you're going through this transition with your adult child. So as I've already touched upon a bit, why is it helpful to have the SSI prior to the SSDI? Well, when that parent starts collecting Social Security or they pass away, if the adult child had SSI, they become eligible to receive the SSDI income on the parent's record. And this is oftentimes going to replace the SSI because that SSDI income is going to exceed SSI, and you can't have both to fall within the income limits for the program. But when a person with IDD, they previously had the SSI, they are considered a DAC under the Social Security regulation. And that does mean they're eligible to requalify for Medicaid after the person starts receiving SSDI. And as I just said before, that SSDI benefit amount is actually disregarded by Medicaid. So even if that SSDI benefit exceeds the Medicaid income limit, which for 2024, for a single adult to qualify for that ABD Medicaid, the limit was $1,255 a month. So if someone was making over that, if they were an eligible DAC, it didn't matter. They would still retain their Medicaid and qualify for those services. So the official definition of a Section 1634 DAC, again, DAC is a disabled adult child. You'll see on the next slide, I've included the flyer that was developed by the New Jersey Department of Human Services. It was recently revised in September 2021. It is still up to date, I can assure you. Now, the actual official definition of a DAC is a person who is receiving SSI benefits. And if they're receiving SSI, remember, they get Medicaid automatically, and they meet the following criteria. They're at least 18 years of age. They have blindness or disability, which began before the age of 22. They had been receiving SSI based on that blindness or disability, and they have now lost SSI due to the receipt of the Social Security benefits on a parent's record due to the retirement, death, or disability of a parent. In other words, they lost that SSI because they started receiving SSDI on the work record of the parent. And of course, remember, the person cannot have more than $2,000 in resources in his or her name. Now, that doesn't include a special needs trust or an ABLE account, which I'm going to talk about those a bit later. So here's the flyer that I mentioned that was put out a few years ago, updated by the New Jersey Department of Human Services. When you access these slides later, you can actually click right on the image and it'll take you to the link to the flyer. And you can read through this fully, but I'm going to be talking about the process through this presentation as well. But if you want to go back to it on your own time, you'll be able to access this very helpful flyer. Now, it looks a little bit different depending on if an individual is enrolled with DDD or if they're not enrolled with DDD. So to start, if someone is enrolled on either the DDD supports program or the community care program, either of the DDD waivers, what will happen is DDD usually sends the New Jersey Family Care ABD request for information or RFI packet in a blue envelope, which includes instructions about where to send the completed form. This RFI packet is the DAC Medicaid reapplication. So when you're getting this in the mail, you want to make sure it says age blind disabled, it says request for information. You'll want to complete this as soon as possible and return it as instructed. After the packet is reviewed, which can take up to about 3 months, you will receive a final determination letter. Now, once your adult child's SSI and their Medicaid terminate, if you're not getting this RFI packet within a week or two, you really want to be on top of it. You want to be notifying your DDD support coordinator about getting the RFI because time is of the essence here. So you don't want to be waiting around for a month, 2 months, and hey, where's that RFI packet I was supposed to get? It never came. Then you're going to start running it, with the possibility that your child's Medicaid coverage will lapse. And of course, we don't want that. Now, if the individual isn't enrolled on DDD, it's totally fine. They don't have to be enrolled with DDD. What will happen instead is that same RFI packet will say RFI, it'll say ABD. It should come in a blue envelope, but instead of necessarily coming from DDD, it should come from your local county board of social services. Same thing is going to apply. You want to make sure you're getting it at least a week, 2 weeks after the person's SSI and Medicaid ends. And if you are not, what you'll want to do is you'll want to contact your local social services office about getting that RFI packet. I included a link here that takes you to the information for all the county offices throughout the state. So if you're not sure of your county office, you can access it there. I included this screenshot. This is an example of the letter that actually gets sent by DDD when a person's SSI and Medicaid have terminated. So you can see it has that request for information terminology. They say we've been notified by the SSA, by Social Security, that your eligibility for Medicaid under SSI is being terminated. And this means when the SSI is terminating, the Medicaid's terminating. But see here, it includes instructions about completing the RFI form to be evaluated for continuing Medicaid eligibility and what documents might be need to be included with your RFI packet. Now, when applying for Medicaid as a DAC, again, I keep stressing this point because it's very important. The adult child with the IDD, they cannot have more than $2,000 in resources with these major exceptions. There's going to be funds in an ABLE account if you set that up already. Now in 2025, you can deposit up to $19,000 per year in that ABLE account. You can have the funds in a special needs trust. Or if there's a back payment from Social Security, sometimes when there's a delay in someone getting approved for SSI or SSDI, Social Security will issue a retroactive back payment for all those months that you would have been approved, you should have been receiving benefits. So they date that back to the original date of your application. You technically have 9 months to spend that money down over $2,000, and it's not supposed to count as a resource for those first 9 months. Now, I have heard of instances with families and Social Security, even though it's supposed to be exempt for those 9 months, sometimes Social Security does cause problems with it. They're wondering why the account's over $2,000. So really what I'd recommend is, as soon as possible, you're spending that money down, or, if you can't spend it all, you don't want to spend it all, totally fine. You're using an ABLE account or the special needs trust. Now, the previous Medicaid from SSI is in effect for about 4 months so that the person has time to do this RFI packet to renew their Medicaid. Do not delay in doing so. If you really get in that RFI packet in a timely manner, there will be no lapse in the person's Medicaid coverage. So even though you see that termination date, actually the coverage will extend beyond it because the state recognizes with these DAC situations that the person is transitioning from SSI to SSDI, and they have to make sure they're doing the DAC Medicaid reevaluation process to continue their benefits. So time is of the essence, but if you do everything in a timely manner, you make sure you're filling out the R5 packet, there should be no lapse in the individual's Medicaid coverage. Now, there's one question sometimes on the RFI packet that asks if the applicant needs long-term services and supports, such as dressing, bathing, or mobility assistance. The answer is going to be no. A yes answer leads to a big problem and a delay in Medicaid approval, because if someone mistakenly fills out yes, Medicaid staff may think the person needs nursing home care. That is, the person would be screened for the managed long-term services and supports program. And this can result in delays or even a denial because the person doesn't actually meet the clinical eligibility criteria. And by answering yes to that one question on the application, they think the person might need the nursing home level care. So if that doesn't apply to you, that your adult child needs that level of care, the answer is going to be no to that question. Now, what about certain circumstances where someone can have SSI and SSDI at the same time? Now, I know I said before that SSDI is usually going to replace SSI. That's still true, but there can be certain circumstances where an adult child with IDD might actually retain both benefits. So here's an example where a person receives SSI and Medicaid at the age of 18, and then later a parent with a smaller work record retires or becomes disabled. The parent receives $900 a month in Social Security. What's going to happen is the adult child IDD, they receive a benefit amount that is 50% of the parent's benefit. So that means they would get $450 per month. So that person with IDD, they will receive a reduced amount of SSI and that $450 per month in SSDI. Since it's under the SSI maximum, that person would actually keep their Medicaid because they still have some SSI. As long as the person has some form of SSI, they would keep their Medicaid. It doesn't matter if they're receiving $100 a month in SSI or they're receiving $800 a month in SSI. The RFI Medicaid application is not going to be applicable in this situation because the person still has SSI and they still have their Medicaid. Now, it's a little bit different sometimes if the person is employed and earning income while on SSI. Please note that if the person's employed, they're working, they're earning wages, SSI is reduced because the more a person works and earns, the more Social Security does reduce their SSI. And this can result in an eventual termination of SSI if the benefit is reduced to zero. In that situation, the person would then need to renew their Medicaid. Now I'm going to talk a little bit specifically about the New Jersey Workability Medicaid, employment, and that SGA limit. Now, New Jersey Workability Medicaid has undergone some major changes over about the last 2 years now. But for those who aren't familiar with the program, it offers full Medicaid coverage to working individuals with disabilities whose income and assets would otherwise make them ineligible. So previously, a lot of individuals weren't able to access the workability program because they might have been receiving SSDI from a parent while working and earning income. So if they exceeded that ABD income limit, they weren't able to qualify for workability. Well, since April 1st of 2023, now the workability program allows for the continuation for up to 12 months following a job loss through no fault of the employee, and they eliminated the resource and asset limit. So there's actually no $2,000 asset limit for workability. That was eliminated. They also removed the upper age limit so someone could keep workability after their 65th birthday. And they also removed consideration of spousal income. Now, phase 2, which actually went into effect almost about a year ago now, February 1st, 2024, has opened the program to all people age 16 and over with a disability determination. And what is now occurring is that they no longer limit eligibility based on income. So if someone's working and earning significant income, they're not necessarily precluded from the workability program. Instead, people who have countable income that is over 250% of the federal poverty level, they must agree to pay a monthly premium. So they wouldn't be prevented from accessing the program, but they might have to pay that monthly premium. And there is more information that's available on the DDS website. I included a link in the slides here. This is also an image of what the premium chart for 2024 looked like. Again, I'm hoping that 2025 chart is out within the next few weeks with updated figures, but this gives you an idea of where the person's income falls and if they'll have to pay that monthly premium. So you can see if they're under 250% of the federal poverty level, there's no monthly premium. If they fall in that first tier, that's 251 to 350%, then it's a $175 a month monthly premium. And it increases as the tiers go up and a person's income increases. Now, regarding the Social Security and the employment piece, if the SSI Medicaid beneficiary is working, you must report wages to Social Security each month. Now, this is a Social Security regulation, not a Medicaid regulation. But to be eligible for benefits, a person must not be able to engage in substantial gainful activity, or SGA. This is something that Social Security looks at as determining whether an individual is essentially disabled enough to work and be self-supporting and whether they can qualify for Social Security benefits. So that SGA limit for 2025 is just over $1,600 per month. Now, that amount does not include a person's SSDI benefit. So if the person has worked and they have enough work credits that they actually receive their own SSDI benefit, or if they do get that DAC SSDI benefit that comes from a parent's work record, that does not go into that monthly SGA limit. That $1,620 a month is really determined by the person's earned income from wages that they're getting from their employment. Now, if a person is still receiving SSI and they exceed that SGA, like I said before, when someone's income increases, SSI is reduced. So they could expect a reduction in their amount of monthly SSI. If the person is receiving SSDI and they exceed SGA, this can result in a termination of SSDI and required to pay back the overpayment. Now, SSA, please know that they can be very delayed in sending notifications when a person has exceeded the SGA level. Social Security handles a lot of cases, and they can be very, very delayed, months, years late in telling a family, an individual, they've been overpaid, and then they can be looking for quite a large overpayment. So really be aware of your child's income on a monthly basis, be aware of how much they're earning, and really, usually the best thing to do in most cases is going to be to keep those earnings under the SGA if you don't want to have to worry about a potential overpayment to Social Security. Now, when it comes to workability and SSDI, it's important to remember that these are different things. New Jersey workability is Medicaid, that is through the state. SSDI is through Social Security, that is federal, it's a national program. So the workability provides the Medicaid coverage as long as the individual remains employed. But while workability does not have the income or asset limit, a person on workability, a lot of the time, they are also receiving SSDI. If the person wants to keep those SSDI benefits, they have to keep in mind the monthly SGA limit. Just because the person has workability doesn't mean they cannot be prevented from losing SSDI. What happens is if someone's exceeding SGA, they're earning too much, they can lose their SSDI, and having workability does not protect against that loss in any way. So these are two different programs. You got to remember the SGA for the Social Security, even though the workability doesn't have an income limit. Now I'm going to talk some more about the ABLE accounts and the special needs trusts, which are two different very helpful financial tools you can use if you do still need to navigate that $2,000 a month resource limit. So the ABLE accounts were established through the Achieving a Better Life Experience Act of 2014, and these allow an eligible person with IDD to deposit up to $19,000 per year in an ABLE tax-exempt savings account. Now, the age of onset of disability It must be before age 26, so there must be documented proof of the disability before 26. That doesn't mean someone can't open an ABLE account after the age of 26. They just must have the proper documentation. The person also must be receiving SSI or SSDI, so some form of Social Security, or with medical documentation, they can deposit money into ABLE as a form of spend down before applying for SSI if they need to get under that $2,000 resource limit. Now, money in an ABLE account, it won't affect continuing financial eligibility for SSI or Medicaid. So you can have funds in the ABLE account in excess of $2,000, and they won't affect the SSI or the Medicaid. And actually, if an individual is working, the annual contribution limit is actually higher than $19,000 per year. So that person could put even more into the ABLE account each year. Now, ABLE accounts, they're available in New Jersey as well as other states. If you want to keep it simple, you want to open a New Jersey ABLE account. I've included a link right there to Save with ABLE. Or if you want to do a little bit more research, you can go to the ABLE National Resource Center at ablenrc.org. That has state-specific information. They're very helpful. They're the National Resource Center. They have educational webinars and state-by-state comparisons if you really want to look at how some of these different state ABLE accounts look. Now, it's very important to note that with the ABLE account, upon the death of the ABLE account beneficiary, the state in which the person lived may file a claim for a portion or all of the remaining funds in the ABLE account to recoup costs that are paid by the state while the beneficiary was receiving services through the state Medicaid program. Now, a special needs trust is a little bit different from the ABLE account. It's a unique type of trust that can be used to establish eligibility for SSI or Medicaid, or you might have already had it set up from when the individual was a child. If you're setting up a new special needs trust, you want to really make sure the attorney is very experienced with this type of trust for the beneficiary. If a trust isn't set up correctly, they can actually jeopardize the Medicaid or SSI eligibility. So you really want to make sure you're working with someone who's experienced in establishing these types of trusts. If that special needs trust is funded, it has money in it, know that Social Security and Medicaid, they're going to want to renew the information. They're going to want copies of receipts from the trust, how you're spending money. They're going to want to know that. So whenever there are expenditures from the special needs trust, make sure you're documenting it and you're saving your receipts. Now I'm going to get into the Medicaid and Medicare or dual eligibility piece. So for those who might not be aware, Medicare begins after 24 months or 2 years of SSDI for an adult child with IDD. So once they've been receiving the SSDI for at least 2 years, whether or not they're receiving it based on their own work record or they're receiving it because a parent retired, became disabled, or passed away, either one works. It just has to be at least 2 years. Now, please know that if there's a parent in the situation who is 65 plus, the typical age for receiving Medicare, this does not automatically result in the adult child getting Medicare. Even if both parents already have Medicare, this still applies that the adult child IDD, they have to have the SSDI for at least 2 years, and then their Medicare begins automatically. No matter what their age is, they can be well under 65. So when someone has both Medicaid and Medicare, again, it's referred to as dual eligibility. And this is that someone can have the Medicare with an ABD, age blind disabled type of Medicaid. The DAC Medicaid is ABD Medicaid, so you don't have to worry about that. As I talked about at the beginning of my presentation, the regular ACA Magi New Jersey Family Care Medicaid, this is not compatible with Medicare. So actually, if the individual is on this regular type of Medicaid, they receive a termination notice when they get notified that they're able to enroll with Medicare. And what happens is they need to be evaluated. They need to be enrolled on an age blind disabled type of Medicaid to also receive the Medicaid while they're on Medicare. But again, as I've mentioned already, the majority of individuals with IDD, they do usually have one of those ABD types of Medicaid, whether it's ABD through SSI or it's through DAC, through workability, or one of those other programs I mentioned. Now, there's different parts of Medicare. There's Part A, which is hospital insurance. There's Part B, which is medical insurance. Without Medicaid, the cost of Medicare Part B premium is actually $185 per month in 2025. This has increased it's just over $10 per month from the 2024 premium. But when a person is a dual eligible, they have Medicare and Medicaid, what actually happens is New Jersey Medicaid pays the cost of that monthly Part B premium. Now, what we see oftentimes is that for the first 2 or 3 months after the individual has just become eligible for their Medicare benefits, that Part B premium, you'll see it deducted from your adult child's Social Security benefit. So if they're getting SSDI, you'll see it deducted from there. But usually what we see is the family doesn't need to do anything. The problem is corrected automatically. And what will happen is Social Security reimburses the amount that was withdrawn from their SSDI benefit to cover the Part B premium. And then moving forward from there, the Medicaid program should be covering that monthly Part B premium. Now, when it comes to Part B and private insurance, because a lot of the time the adult child IED can still be covered under a parent's private health insurance plan through an employer. Again, I suggest not declining Medicare Part B, even if the adult child has private health insurance, because again, Medicaid is paying that Part B premium. It's not coming out of your pocket or your adult child's pocket. Now, what happens if Part B was actually turned down and then private health insurance ends? When the individual is ready to start on Medicare Part B, the parent with that health insurance that's covering the child, there must be a letter from the employer that documents continuous, credible coverage from the date when the person was first eligible to have Medicare Part B, but they refused it because of the private health insurance coverage. This helps the individual avoid that late enrollment penalty that's imposed when an individual declines Part B when they're eligible and they didn't have that other credible coverage. Medicare Part D is the other major part of the original Medicare package. This is the drug coverage. So when a person has both Medicare and Medicaid, prescription drug coverage is provided through Medicare Part D. Again, if the person also has private health insurance with a good drug benefit called credible coverage, then you can opt out of Medicare Part D. To do so, you'll want to call 1-800-MEDICARE. Now, Medicaid is not seen by Medicare as credible drug coverage. So even though the person might have had Medicaid drug coverage before they became enrolled on Medicare, once they become Medicare eligible, Medicaid is not seen as credible drug coverage. So they either have to have it through a private health insurance plan or they have to have it through Medicare. What we have done in the past is the ARC of New Jersey has usually done a webinar each November that covers Medicare Part D and upcoming changes for each year. If you navigate to our Medicare resource page, which I've included a link here, you can access that webinar as well as some of our other resources. We also have 3 fact sheets that we use in the form of frequently asked question or FAQ fact sheets. One that just covers general information for dual eligibles, one that is specifically focused on Medicare Part D and prescription medication, and a third that covers dual eligibles and special needs plans or DSNPs, which those are a unique type of integrated Medicare, Medicaid, all-in-one plan for individuals that have both, and those are a voluntary option if someone has Medicaid and Medicare. The last thing I really want to cover here is potential continuation of the parent's private health insurance after the age of 26. So under the Affordable Care Act, all young adults were permitted to stay on their parents' health insurance until the age of 26. But there is a special process for dependent young adults with IDD who aren't capable of self-sustaining employment. They are chiefly still dependent on living with their parents to stay on their parents' employer's health insurance as long as the parent has that health insurance, and that can extend beyond the typical age of 26. What you'll want to do is before your child's 26th birthday, I'd recommend beginning the process at least 6 months in advance. You're going to want to request the needed forms from the employer's HR department of whichever parent has the health insurance that is covering their adult child. And actually, some people may not know this, but you can have that private health insurance, Medicare, and Medicaid for your adult child IDD. It's actually possible to have all three, Medicare and the private health insurance. One of those is going to be primary. And what happens is Medicaid is usually always going to be that last payer. And we also have a very helpful fact sheet that goes more into depth about this process available on our website. And there's a link right here on the bottom of the slide. But that is the extent of my presentation tonight. And now I'll be happy to do questions and answers.
Connor, before we start that, I had 2 questions come through the chat. I'm wondering if you would address first.
Sure.
Yeah, so Tara P asks, what happens if an individual begins receiving SSDI on a parent's work record due to retirement before they turn 18 and they get SSI on their own? I think the term is non-DAC.
Yes. So I touched upon this a little bit in my presentation, but if someone starts getting the SSDI before 18, they have been referred to as a non-DAC, then usually makes it difficult to get the SSI at age 18. If the person does need to qualify for Medicaid in order to get those DDD services, there is a unique process where the person can get approved through the DDD waiver unit, get that non-DAC approval. And what actually happens is when the individual becomes eligible for DDD services, which is usually age 21, at that point, they're then granted a Medicaid application. And what happens is that DDD waiver unit, the non-DAC, has a higher income limit that allows them to qualify. And I will say, if that applies to anyone, we do have a Medicaid eligibility problem form on our website, specifically if someone is facing those barriers to Medicaid eligibility.
Thank you. I did drop your website into the chat, www.arcnj.org. That's arcnj.org. Okay. Now, Gary, I'm not sure I'm understanding this one, but is there a Gary asks, is there a handout or a link that I can give to consumers and families that explains what items qualify for spending down to maintain under $2,000 per month, whether that be for monthly income or for a windfall payment from SSA? Specifically, is spending it on a vacation okay?
Mm-hmm. So usually there's guidance on the SSA.gov website that you can find. I don't have a specific handout to use, but usually if you're spending it for the benefit of the individual with IDD, that's usually going to qualify for whether it's SSI or SSDI. And ABLE has the same parameters. If you have money in an ABLE account that you want to spend as well, if you're spending it for the benefit of the individual with IDD, so things like, say, medical or other health needs that aren't covered by insurance, therapies, medical equipment, those would be eligible for purchases. And there can also be recreational expenditures as well. If they are for the benefit of the individual with IDD, there usually is a bit of a leeway there. But I know there is, when it comes to SSI and SSDI, they do post some guidance on the SSA.gov website.
Thank you. Another question, Medicare Part B, Medicaid paying. Does it matter if it is Medicaid received through the county versus regular Medicaid?
So like I mentioned, someone has to have an aged, blind, disabled, or ABD type of Medicaid that's compatible with Medicare. It doesn't matter what ABD Medicaid program they have. If someone has workability or they have the DAC Medicaid, Any of those are fine. The state will still pay for that Part B premium. It's just that the Medicare is not compatible with the regular Medicaid that is not tied to an individual having a disability. They must have an ABD type of Medicaid.
Okay. C asks, what happens if a person had SSI, worked, then received SSDI on their own record? Then their parent retired and collected their own SSA, but not until age 70. How do they figure out which benefit the child will get since the parent waited till 70 and that benefit is higher?
So what happens in these situations is that the child does become entitled to the higher benefit. It does require correspondence with Social Security. They might have you fill out a new application to receive that higher SSDI benefit. But usually what happens there is Social Security notifies the family, and then they go through the process to make sure your child starts getting that higher benefit. But when this happens, whether it's a child going from their own benefit to a parent's record, or also if, say, the child is receiving mom's benefit and then dad retires and it's a higher benefit, same process applies. They get approved for the higher benefit amount.
Excellent. So at this point, you can either type your question into the chat if we didn't answer it yet, or you can raise your hand. There's a little hand you can click on. If anyone has any more questions, we'll leave that open. Yeah, okay. All right, I don't see anything else. Yeah, I don't see anything else right now in the chat. So, yeah, thank you so much for participating and asking such great questions.
Yvette raised her hand.
Oh, Yvette, I'm sorry.
Yvette.
You can unmute.
All right. Can you hear me?
Yes.
Yes.
Okay. Here's a quick question. My daughter used to receive, she's eligible for SSDI, but she no longer receives it because she made enough money. So I had to apply for the state Medicaid. How will that affect her receiving benefits when my husband retires this year?
So she was receiving her own SSDI, and then she was working too much and she stopped receiving those benefits?
Correct. They said she's still eligible, but she gets none of it. So I had to, since she didn't get it, I had to apply for the state Medicaid as opposed to the federal Medicaid, reapply for Medicaid through that avenue.
And did she have SSI before?
Before the SSDI, probably been many years. She's 40, so yeah.
Okay, so I think even when your husband retires, she could still become eligible for the DAC benefit. It would be based on his work record instead of her own.
Okay, so well, I don't want to tie up everybody. So she would she have to the RFI packet? She filled one of those out when we applied for the Medicaid through the county. Would she fill out a new FRI packet?
As long as she has Medicaid, she wouldn't. But then once, if she started receiving that SSDI benefit again, that made her ineligible for her current Medicaid program, then she'd have to fill out an RFI packet.
All right, thank you.
Yep.
Okay, we have Dina who's asking a question. You can unmute yourself, Dina.
I did. Thank you. Connor, I know Medicaid does, each state can put their own eligibility criteria and things. I actually sat on a webinar earlier from ARC United States talking about a lot of this. Is New Jersey the only one that has this $2,000 limit? Because it is so archaic. This limit was there before you were born. It is so archaic. And what can we do to advocate to get that raised? $2,000 is nothing in today's world.
No, it isn't, Dina, and it's also tied to Social Security's had the same resource limit since the inception of the program in 1981, I believe. it hasn't been raised. It needs to be raised. It really is an archaic limit. I'm not sure exactly on all the other states' Medicaid programs, but I know some of them have raised it substantially in recent years. I think New York was a model. They raised it to at least, I believe, 10,000 per year, which is a massive difference. On 2,000 really is nothing. So believe me, it is one of the priority items with the ARC of New Jersey and even our national chapter to look to raise Medicaid limits. It's something that we are prioritizing. We see as important, though unfortunately, I think what we're seeing in the last 2 weeks with the coming year is now we're potentially facing even cuts to the Medicaid program as a whole. So, but believe me, it is one of our areas where we advocate on, and it is a priority.
Thank you. Keep me in the loop because I'll do whatever I can down in Trenton.
Thank you, Dina. I will.
We have someone who joined our call with a phone number raising their hand. Go ahead and unmute yourself.
Hi, can you hear me?
Hi,
Yes.
yes, we can.
Okay. And you probably asked this question already. Someone must have, but I had to step out and get my son from work. But my question is, my husband is on retired, so he's receiving SSI because of disability. But he worked all his life. Now my son is receiving SSI, and I think he's receiving the other one. My question is, I would like to retire in the next couple of years, and my income, I'm concerned if how it's going to affect my son's income. Would it get reduced, and my husband, or?
So what would happen is once you retire, your son would be eligible for SSDI benefits that'd be based on your work record. It would be 50% of what your benefit would be. And usually what happens is if an individual's on SSI, that terminates their SSI and Medicaid, and you have to go through the RFI reapplication process to continue on Medicaid while the child is receiving the new SSDI benefit.
Now, if so, that means his benefits are going to be cut in half because of my benefits, because I'm retiring.
So his benefits aren't cut in half, but he would receive, if you retire and you start receiving a benefit amount, he receives a benefit amount that's equal to 50% of what you would earn. So if you started getting $3,000 per month, he would get a benefit amount that's $1,500 per month.
Okay, I see.
Mhm.
Okay, thank you.
Sure.
Okay, so something came through on the chat from Thomas DePatri. Is there any advantage or disadvantage to putting your DAC on your private health insurance?
So I would say for the most part, a lot of families do look to keep the DAC on the private health insurance as long as possible, as assuming every family, every insurance is different, the costs associated with keeping your child on the private health insurance. But I know a lot of families like to utilize what can be a more comprehensive provider network that's available through your private health insurance compared to, not every provider wants to take Medicaid or Medicare. So keeping them on the private health insurance as long as you're able or willing to, it can be very advantageous to access, sometimes doctors you've been seeing for your child's whole life. And if they don't take Medicaid or Medicare, then, that kind of only gives you one option. So it really does depend on the family and the situation. But most families I've spoken with, they do like to keep their child on the private health insurance as long as they can.
Okay. Anything else? Anyone else? Okay. Well, this is probably my third time listening to this same presentation. I learn something new every time. I don't know if it's because I'm paying attention better or whether, my husband's going to retire in probably like 3 to 4 years. And it's just very real for all these listeners and all these callers. This is like real life for us, and it gets extremely complicated. So thank you for breaking it down for us, Connor. Really appreciate that. Like I said in the chat, everyone will get a recording of the webinar and also a copy of the slides. I know that you said that some of them had clickable links on them, and I'm a little concerned if you send it over at PDF, if they'll be able to click on them, but we'll figure that out. And even if you can't, you can just maybe, you know, copy the link and follow it yourself. Does anybody have any, did you have any last comments, Connor?
No, I'll send over a PDF and a PowerPoint. They should have clickable links in there that can be accessed. If anyone has any other questions that come up, or, you know, you really have, you know, personal information you want to share on the call, please follow up with an email. I've included it right there in the slides. I'd be happy to, you know, speak with you, answer any questions you have. But very thankful to be here tonight and provide, you know, this great information for families.
Why don't you read off your email address for me? I'll type it into the chat.
Sure. So it is Healthcare Advocacy at arcnj.org.